Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I am an oral and maxillofacial surgeon practicing in Denver, Colorado. The goal of this podcast is to connect, learn, and inspire. In this podcast, you'll be hearing from OMS surgeons all over the globe discussing ways to improve the practice of oral and maxillofacial surgery. Most information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with approved research studies. Without further ado, please enjoy today's episode. All right. Welcome back, everyone, to another episode. Today I'm with Dr. Roger Levin, CEO of Levin Group, a management series group. We've been doing a number of podcasts to kind of help on the business management side of oral surgery / dental practices. And we're going to continue our discussion on kind of developing the office manager. Roger, thanks for joining us on the podcast.
Oh, Grant, I'm thrilled to be here. I love doing this with you. This is episode 5 of our Office Manager Mastery series. So I look forward to sharing some hopefully really interesting information with everybody.
Yeah, this will be great. So we've talked a little bit about some of the roles that an office manager kind of has to juggle. Where would you take us in the next step of helping our refinement process of the office manager?
Sure. Well, we've had a lot of good conversation about a lot of the roles of the office manager. And I'd like to start by reminding everybody, especially if somebody's just jumping in on episode 5, that this came about because our data indicated that 96% of dental office managers had no real management education, background, or experience. Now, if an office manager is watching this, that's not criticism. I think many office managers will turn into fantastic, comprehensive office managers. But we realize that there's a lot of training that's needed, especially when you have no background and you just get promoted because you've been there 20 years or we trust you or whatever it may be. And that's why office managers are all over the place in what they do, how they do it. And most are doing it at a lower level, but have the capability to do it at a higher level. So the thesis is that your office manager needs to become your chief operating officer or COO, which means very simply, love to keep things simple, the office manager should ultimately be handling all non-clinical activity in the practice. And I literally mean all non-clinical activity. So Levin Group went out, we built a consulting program called the Office Manager Practice Mastery Program to address this because there's very little out there. And one of the things I did that we're going to work on today is created a visual, the office manager pyramid, as you can see on the screen, to help explain the reality of where office managers are and where you can take them. But again, they will need training in order to get there because they didn't come from corporations where they have had 4 bosses in the last 12 years, each one being a mentor and teaching them new things, and they've been promoted. The term is parachuted. They suddenly got parachuted into this job where many are still doing what they used to do, plus this job. Many are just cleaning up messes from the rest of the team. And by the way, when you're cleaning up messes, it's very hard to grow. When you're cleaning up messes, you stay cleaning up messes unless you understand how to go forward. So the first level, Grant, as we can see on the left side of the pyramid, is called functional, the functional office manager. And we have now enrolled many, many practices into this program. It's gotten a lot of interest. And truly, about 96% of the office managers joining us, and by their choice, we want the office managers to be excited about this, fall into that functional level. They don't have any previous experience, any previous education. So on the right side, we see the 3 components, the 3 levels of a functional office manager. And at our lowest level, level 1 of 10, we call this process. This is where the office manager comes to work. This is most office managers. They want to do the best job they can of getting through each day, cleaning up messes, getting things done, the things they know to do. There are many things they don't know to do. And they work hard to keep the process of the day going. Whether it's the schedule, whether it's collecting money, whether it's communicating with the referring office, because oral surgeons need to get back to being just oral surgeons. Oral surgeons should be spending their time chairside with patients, doing clinical treatment, or talking to referring doctors. That's about it. And if you can focus on just that, your practice will be wildly successful. We're talking to some very successful oral surgeons. But my compliment to the oral surgery specialty, because we've been working in consulting for 42 years and oral surgery for 42 years, most oral surgeons we meet truly want to get better. Even if they're successful, they want to keep improving. And the best way to not decline is to keep growing. So at level one, we have this process office manager. They're probably not going to change much. They're going to do the same things most days that they've always done. They're not going to contribute to the growth and development of the office. They're focused heavily on making sure we get through today and get the basics done, the basics they know to do. Now, the next level up, and this is what we're teaching very early in our program, so I encourage everybody to jump on this, are the numbers. The next level up is when the office manager can really assess the practice KPIs, key performance indicators. They know what production should be. They know what the daily goal is. They're studying the average production per patient, the average production per referral source, the average production per procedure, the average production per provider. Many office managers that we're working with right now had no idea how productive or unproductive some of their doctors were. And this is important because then they can decide who wants help, how can they help them, how do we change the schedule. So knowing the numbers is important. And just for our listeners, to get very granular and practical for just a moment, I would focus first for this office manager on the production numbers. Total production, production per day, production per hour, production per provider, production per new patient, and production as a ratio of overhead. And watch overhead carefully, everybody. It is rising. We're seeing more practices than ever before where production's going up and profits going down. And the only reason for that is overhead's growing faster in some cases than profit. And if nobody's looking at this, and it should be the office manager saying to the doctors in a monthly meeting, which we've talked about in other episodes, and everybody go back and listen to the other episodes if you haven't heard them, because it's a buildup. But in that doctor's meeting every month, the office manager should be reporting, hey, we've got a problem with overhead, or overhead is good, it's outpacing production increases, etc. And then the third one is huge, but I'm going to cover it quickly. Putting systems in place. What should the new scheduling system be? You've got to update scheduling regularly. What should the case presentation system be? Do we have an implant treatment coordinator, or do we not have an implant treatment coordinator? And either way, we still have to have a great sales process that's positive and motivating and influential for the patient. So systems are how businesses run. The best businesses have the best systems, and this is the responsibility of the office manager to observe them, test them, measure them, implement changes, and measure those changes.
Nice. So for those who can't see the diagram, if you're just listening to the audio, like the base of the pyramid is kind of the overall level one, which is the functional, and the subset inside there is process, the numbers, the systems. So that's kind of I would assume, the basic stuff that keeps the practice going each day. I mean, important stuff, right? Critical stuff. But you're saying this is kind of I mean, why do you label it functional? It's more of um, the function of the systems, as opposed to we're going to get into people and the overall thinking.
Exactly. It's the functioning of the practice day to day from a logistics standpoint. That's why it's process, numbers, systems. And this is also the order in which an office manager needs to be trained. Because if you have an office manager who's great at managing people but has no idea what the systems should be, then it goes to that quote. And I don't like this quote. I've never liked this quote, even though I say it. If you motivate an idiot, what do you get? You get a motivated idiot. So I don't like it. It's negative. It's not a nice quote, but it makes the point that if you are really good at handling people, but you don't know what to teach them, and they don't have a foundation and they don't have systems, then everybody's going to be running around very happily doing the wrong things. So that's why the first three levels of 10 of office managers is the functional level. You've got to have your function or foundation in place for business operations.
Got it. Okay. So what is level two?
Okay, so level two. And let me point out to anybody who is looking at this or not, it shows 10 levels going up the pyramid. We actually look at each office manager when we start and say, okay, this is a level three office manager. And 6 months later, we hope to be saying, oh, this is a level six office manager. So this is a real measurement tool that has never existed in dentistry before. I don't know if it existed anywhere. I created it. I think it's good. I hope it's good, but it gives you something to use, not to evaluate performance of the office manager, although it does, it gives you something to use to see where you can take them and what improvements have occurred. So the second level we call the people office manager. Part of the job is managing the team. And office managers, there are two choices here. They can manage strictly the administrative team, or they can manage the entire team. If I were an oral surgeon, I would want my office manager comprehensively trained to manage the entire team. Now, the office manager's not teaching implants, trace setups, clinical information. That's the doctor's job, the surgeon's job. But in terms of issues, vacations, time off, conflicts, all these different aspects of people management, I, as a surgeon, wouldn't want to deal with that. I would, in my career, Grant, I have a very bad or good habit. When I finally make a decision, I tend to talk out loud to myself very briefly. And many times over the years, I have heard myself say, because I think sometimes things come out of your body and your mouth before your brain gets it. And I will actually hear myself say, I'm not doing this anymore. And I say it out loud. And I've learned that once I say that, I mean it. I am not going to do this anymore. Then the next question is, so does it have to be done, or who's going to do it? If it doesn't have to be done, that's easy. If who's going to do it, then you've got to help those people understand the process of delegation. I would love, as a surgeon, to delegate. I'm not a surgeon, I'm a general dentist, but I would love, if I were a surgeon, to delegate everything possible to the office manager. That is their job. That is why they are there. I'm even in favor of increasing their compensation if they can grow the practice, by enough, meaning that they have to be worth it. But what they can do for the practice is amazing. So the people manager handles all human resources. Now, this can be very complicated. On one hand, you've got HR, human resources, law, and regulation, and every state is different. I'm on a panel every Friday that gets 1,000 to 2,000 dentists, and a labor law attorney's on the panel, and he makes presentations, and sometimes I comment on them. The law is the law. It is mainly black and white, as long as you want to stay out of court and protect yourself. And the office manager has to be up to date. Now, fortunately, every state has courses on labor law that you can attend, so just go look them up. What is hard to teach is managing people. I have a saying, people are messy. And I have another saying, business would be easy if it weren't for the people. So people make things complicated. We have a lot of different people. You get up in the morning, your child's sick, you're taking care of an elderly parent, your tire is flat in the driveway, you're having trouble paying a bill, you ran out of gas. I mean, there's terrible traffic jams. You didn't sleep last night, because you were watching the NCAA finals or something. It is amazing how people come to work, and everybody most days is pretty much themselves, but there are lots of days where we're not. And then you have to interact with others. Well, the office manager at the second level or middle level of the pyramid has to help and monitor and manage people. So the first thing is, for an office manager, we recommend compassion, that you should treat your team with compassion, and your job is to come to work and make it possible for them to do a great job. And if people have problems, and people will have problems, how can you help them in the best interest of the practice, but also their best interest? And I've got so many stories where little or big things were done to help team members, And the loyalty that you get back from that, the commitment is huge. But it's a day-to-day managing because people are different day to day. Now, I'm going to digress for a minute. Something you and I've never talked about, Grant, is, well, what should the makeup of the team be? Because when we advise office managers, over time, nothing fast, nothing dramatic, it's great to build toward a specific model I call ABC. Now, there are human resources experts that tell you should have 90% A players in your practice, and that's it. Well, this is dentistry. This is completely unrealistic. These are not Harvard MBA executives, and you're never going to have 90% A players unless you're a very rare situation. Instead, what I recommend is called 40-40-20. 40% A players. They are outstanding. You do not have to manage them. They manage themselves. They are strategic thinkers, strategic action, motivated. They get it done. They do not need your help. And then you have 40% B players. B players are great. They have the ability to get things done. They do need office manager input along the way. But the great thing about B players is they can become A players. And they don't all become great players, A players, but they can. And then you have 20% C players. Your C players are your workers. They're just workers. And we need them. We need workers. They're never going to become Bs. They're never going to become As, but they show up every day. They do their work. They make some mistakes. They don't get everything done. But the 40-40-20 model is something for office managers to at least think about as they're developing the team. Then so compassion was number 4, letting the team know you care and you're there to help them and guide them, but not micromanage them and not do their jobs for them. That would be a mistake. So then we go to the 5th level office manager in this people office manager concept called culture. And more than even the doctors, the office manager has time to build the culture every day. Once you know what your culture is, the office manager should be focused on reinforcing it. And that's the key word here, reinforcing it every single day. And an example would be an article I wrote this week. I called it the positive practice. And I said in the article, normally I try to be hyper practical, give key recommendations, but the article was more on what happens if you have a positive practice. Well, what happens is you have happier staff, happier patients, happier referring doctors, better reviews, more case acceptance, and more profit. And I've been around 42 years now, and our consultants will tell you, I can tell you, we talk about this regularly. It's real. Can't put a number on it. How positive are you? But when you have a positive culture, the practice is simply more successful. But it's the office manager throughout the day that has the opportunity to comment on it, to remind people, to remind them when they're just chatting, to remind them in a performance review, to remind them in a staff meeting. So that's 5th. And then the 6th level, which is the top of the people level, is longevity. Now, longevity is more important than ever before. Why? In the past, we wanted longevity because replacing people's miserable. It's a pain. It takes time. You don't always get the right people. Then you've got to train them. That's why so many practices will keep a toxic team member far too long, because the pain of changing them in their mind outweighs the pain in keeping them, which may be true, but in the meantime, they're destroying your practice. Because they cause all kinds of problems with the rest of the team. So instead, we want to focus on longevity today because there's a staff shortage. So when you lose team members, you've got to really work to find great people, A's and B's, to bring into the practice, sometimes a C. And in order to do that, you want an office manager that creates an environment where people want to stay. They're learning more, they're doing more, they have the support they need. And the office manager is the person on the ground, so to speak, that makes all of that happen.
Got it. I'm guessing like this, especially the point on culture, could probably be its own podcast, but not to get too much in the weeds, but one question is, how do you as the surgeon or the manager like assess what the culture is, and where to improve it?
Okay, so the first thing everybody should know about culture, and this is really important, either you will pick your culture or it will pick you. Most offices, the culture has picked the office, meaning there's conflict, there's annoyance, there's negative talk about patients or referring doctors. There are happy and unhappy people. There are cliques. We hire a new person. We don't like her just because she's new walking in the door, all that sort of thing. And you and I've talked about a lot of these management techniques in other podcasts. So, first of all, pick your culture. For years, we asked our clients to think about what kind of culture they wanted. And then we came up years ago with the idea of naming the culture. Finally, Grant, I said, okay, enough of all that. Let me make this simple. You need a positive culture, and the name is the culture of positivity. Now, any client can change it to whatever they want, but in my mind, what could be better than walking in every day to a culture of positivity? And a culture of positivity is where everyone comes to work positive. Okay, where does this start? It starts with the surgeon. Being a surgeon is a serious job. I mean, all of dentistry is a serious job, but surgery, you're dealing with some pretty significant treatment of patients in many cases. It is surgery, hence that word. You're in bone. Sometimes they're accidents. Sometimes they're infections. Sometimes you got a referring doctor that took out half a tooth and now wants you to get the rest of it out for them because they couldn't. And while you're frustrated with them, you're trying to protect them and do treatment at the same time. And yet, all through any of that, the surgeons need to come to work positive. I was explaining to someone the other day that I have many lists, but one of my lists is called the frustration list. And there's certain lists I review every Sunday when I'm getting ready for the week. And I don't mind saying I have frustrations. Sometimes I have none, sometimes I have 10. Just depends what's going on. But whenever I have frustrations, they go on the list and I put them in priority order. I love knowing my frustrations because instead of just being frustrated, it tells me what I need to work on. So when I see frustrations, what do I need to do? Can someone else do this? Can I hire someone to do this? Do I have to do this? Okay, if I have to do it, what's my next step? Surgeons need to take frustrations and put them away and deal with them, but come to work positive every single day. And that's where it starts. But today we're talking about office managers, and the office manager is not a member of the team. That's a mistake. They are the head of the team. They can be friendly with the team. They can be best friends with a team member, but they are not on the team. They oversee the team. And they are sandwiched between the surgeons and the team, which is a very difficult place to be at times. But their job day to day is to reinforce that culture because surgeons need to be doing surgery. And when surgeons can, they should comment on a positive culture. But the office manager has a lot more time to reinforce it than even the surgeons do.
Okay. Yeah, that's really helpful. Where do we go with the third and like peak of the pyramid level?
Okay, so my hope is that in this new program we created, we get lots of office managers to the strategic level. I know it's a minimum of 12 to 18 months. I know there are some people who can be good office managers, but they're never going to get there, and that's okay. But level 3, the top third of the pyramid is called strategic thinking. And this is something you can teach if a person has the ability to learn it. I think overall we might get 5% up to this level, but I want to challenge every surgeon and office manager listening, you should work toward strategic thinking. Because at the strategic thinking level, you are no longer just managing day to day. Now, if you can't go from level 1 to level 10 in one big jump, if you don't get the functional parts in place, you can't become the people manager. And if you can't manage the people, strategic thinking is a waste of time because you will not have time to implement it. The goal at the strategic thinking level is the office manager now has the team doing their jobs independently. They know what to. There are 3 things I talk about, very simple: knowing what to do, knowing when to do it, and knowing how to do it. That's all any staff member needs to do. What to do, when to do it, and how to do it. And then what results are expected. Once you get that in place, now the office manager has time to start to think. And I know it sounds funny, but IBM, when it was one of the biggest companies in the world, one of the most successful companies on the face of the earth, it's still a big company, but it was the Microsoft, it was the SpaceX of its day. And The Thomas Watson, one of the greatest CEOs of any company ever, had signs put everywhere at IBM, all over the place, and had one word on it: think. That was the only word. I was invited to an IBM conference on innovation a couple years ago in Manhattan. And when we got there, we were all given these very nice notebooks. We always get spiffs at these CE programs and different things, but it had one word on the front. It didn't say IBM, it said think. So think is a really important concept. So at the strategic thinking level for the office manager is 8, 9, and 10 of the 10 levels that an office manager can become. Level 8 is increased production every year. What can be more important than growing the business? Now, you might want to grow it a lot, you might want to grow it a little, but if you're not growing, you are declining. So when surgeons call us, which happens a lot, and say, hey, I'm doing really well, but we're flat. Well, there's no such thing as flat. Because if your production's flat in this year versus last year, then you're going to be down in profit by the amount of inflation. So let me go over that again. Your production doesn't grow. So you get to say, oh, we're flat. We're not bad. We're not hurting. We're just flat. Well, I don't agree that that's not bad. Because if inflation is 4.5% and dental inflation is higher than normal inflation in the country, so let's say inflation is 4.5%, but your production's flat, your profit is down, net just dropped by 4.5%. So that's really important to understand, especially in light of the way our insurance companies don't raise their reimbursements. Okay, so increasing production every year, an office manager that takes the time to think of ways to increase production. There are courses, there are webinars, there's seminars. I've shared many with you on these podcasts. There are over 200 ways to increase production in an OMS practice. About 20% of those 200 will get you 80% of the growth. So if an office manager takes on 1 here, 2 here, 3 there, they're going to increase production. Above that, number 9 is achieving vision. Where do you want this practice to be in 5 years? We have a service here that I love, and I actually do 6 a year. We work in teams of 2. I love it so much. I do 6 a year with my partner, called strategic planning for the dental practice. And we have brought a Harvard Business School method of strategic planning that really answers one question, Grant. Where do you want to be in 5 years? And I always encourage office managers to work with the doctors to answer this question. Where do you want me to take? I'm the office manager. I'm going to grow with you. Where do you want me to take this practice? Do you want to open another office? Do we need another associate? Are we adding a new service? Are we bringing in a new technology? What's the vision over the next 5 years so I can get to work on making that happen? And then finally, the highest level, we just call the level 10 office manager. And the definition of that is not about the office manager. It's about the surgeon. When a surgeon can show up at work in the morning, get ready for the day, attend the morning meeting, treat patients, and go home 90% of the days, that's when you have a level 10 office manager. By the way, you're still growing. You don't just do that, you're still growing. And I have told you the story where I was lecturing on this, and I get an emergency phone call Monday morning from an office manager I've never met. This is a few years ago. We did not have the office manager mastery program yet, but she was at my lecture. I'm sorry, she was not at my lecture. Her surgeon was at my lecture, and he came back on Monday. And when you have a level 10 office manager, you have what we call a level 4 surgeon. Show up in the morning, get ready, attend the morning meeting, see patients, go home. And he walked in and he said on Monday morning, I am now level 4. This is all I'm ever going to do from now on. Don't ask me anything else. And she panicked and called me and said, what do I do? I said, well, he missed a few steps along the way. And then we had a conversation. You can't just go from, yeah, I was an assistant last week. I've been an office manager for 6 months. I have no experience, but now I'm going to be level 10. You have to climb the pyramid, and it's fun. And you add to your knowledge and you're helping other people. I say to office managers, one of your greatest legacies should be all the staff members you help to grow, and you help them to do their job, to learn their jobs so they can work independently and be very happy as well. So that level 10 office manager, they are out there. We met one about 6 months ago. She was a wife, which very often a spouse where a spouse who's really committed and really sharp comes with a level of commitment that's incredible. And she ran a multi-million dollar OMS practice, three partners, and she ran it really well. I mean, when we were talking to her, we were so impressed with her. And we said to her, look, you're doing a great job. Would you learn more in our program? Sure. Do you need our program? Not necessarily. And I wasn't surprised. She said, I'm doing the program. And the reason that didn't surprise me is the people who often want to be great keep going. And as I've explained to many people, the more you know, the more you will have to spend to learn less in the next course or the next program. Or it's like when you go to Harvard Business School, if you've taken enough courses there, you won't learn as much in the next course, but it's still invaluable information what you do learn. So the three levels, let's just sum up. On the pyramid's broken into three parts. The bottom third's the functional level, the middle third's the people level, the top third is the strategic thinking level. And then on the right side, I identified 10 levels of office managers, and it is so rewarding to see them moving up the ladder. And they're so hungry for this knowledge because most office managers want to do a great job.
Yeah, I love that. I think that graphic kind of helps. I would imagine it helps know where to start. It kind of knows, where you could progress to. I'm sure it's not like you have to do everyone exactly in that sequence. You could probably work on culture at the same time you're working on systems or compassion. But
Mhm.
it seems like in general, that's like the right pathway to go through. It seems very intuitive.
Yeah, the reality, Grant, I've thought about this concept for many years is, today we're having sort of an academic conversation. And I'm not an academic, but I have a lot of respect for them. And one of the things academics do is they take what's happening and they try to put it into a model. So for the last 42 years, I've done nothing but build models, whether it's systems, whether it's how-tos, whether it's steps to achieve goals. And what we're looking at here is a model. I think it's a good model as far as I can tell. We keep testing it, but there are no perfect models. So if an office manager said, okay, I'm going to really work on these production numbers. And they might even already get started on how to increase production, which comes at level 8, even though you can do it early on. And I'm also going to work on the culture. It won't be perfect because the systems aren't in place yet. So people don't quite know what to do, but I'm going to work on both of these simultaneously. So you're absolutely right, Grant. That was a great insight. You can do more than one thing. What you can't do is be a functional office manager at the bottom three levels and make a jump right to the level 10 office manager where the doctors can ignore the practice 90% of
Right.
the days. That, I always say to surgeons, leadership is about delegation, not abdication. You still have to coach,
Mhm.
motivate, encourage, measure. There's a big difference between delegation and abdication. Now, at level 10 of office manager, the surgeon can start to abdicate most things. And you might say, well, is that the responsible way to go? And my answer is absolutely. Everyone in the practice, great concept coming here, should only be doing what they do best and they need to do in their job. Surgeons do a lot of other people's jobs, and office managers do a huge amount of other people's jobs because they clean up a lot of messes. They make sure things get done. They pitch in, when things are busy. Next thing you know, the office manager is on the phone at the front desk. And it sounds good. She's really pitching in. Well, reality, that's not good because when you're doing someone else's job, you're not doing your job. And we see this all the time. Things that don't get done that are really important, they can be put off, but they don't get done. They're really important because you're doing other people's job because they're not doing it themselves.
Yeah, love that point. Delegating, still kind of being aware of and part of the process, knowing what's going on, not like just saying, "Hey, you take care of it. I don't want to hear anything ever again," and kind of ignoring that there is a business there and a process.
Yep. We had one situation, it's just a one-off, it was rare, where we started working with an office manager, and then the consultant got a call from a staff member at the front desk that said, "Hey, she's embezzling." Now, we have to be very careful when we hear things like that. Accusing someone of that, if it's not true, is very legally dangerous, and we are not forensic accountants. So she said, what what should I do? And the answer was, you should talk to your surgeon. I was a three surgeon practice. I said, you should talk to one of the surgeons because we have no information, evidence. That's not what we've been hired to do. And if it is true, they need to know. And the way you say it is, I think you just need to check on this. Well, unfortunately, it was true. By the way, this was a very competent office manager, but unfortunately competent in more than one way. So, and she really had the surgeons out of the financial area of the practice because she was smart enough to keep them out of it because she didn't want them seeing anything she was doing. So that's just a rare situation. But if a team member wants to talk to a surgeon, they can do that by all means, and the surgeon is still a leader. And this isn't about catching people doing things wrong. I don't like to focus on that as much as everybody should be comfortable talking to everybody, but getting the job done is really important, and that's the role of the office manager, overseeing the team, the systems, the numbers, the culture, the vision, and everything else we talked about.
Love it. Well, awesome. Thank you for describing the office manager pyramid, for kind of running through each portion of that. I think that will help a lot with developing our office managers, knowing, where to go with the vision of the practice and just, continuing to inspire growth. And then as usual, we can put your contact info in the show notes if people have questions, things like that. If someone wanted to get a little more information about the office manager pyramid, where would you direct them?
Well, if they just want the pyramid, I will give my email. Actually, I'll give my email. Anybody can email me. If they're interested just in a copy of this pyramid, that's fine. If they're interested in knowing about the program, we have people who are happy to talk to anyone. We are not pushy. We don't do hard sell. We're here to communicate with people and make a difference. So my email, I'll say it twice, is rlevin, RLEVIN, CONF, rlevinconf at levingroup.com, rlevinconf at levingroup.com.
Well, thank you. I look forward to continuing our discussion and to further podcasts. I really appreciate this because I know it takes a lot of effort and work to produce great content like this.
Well, the difference you're making, one thing, Grant, I'll say is I've always wanted to focus on making a difference for 42 years. I still feel exactly that way, and you really are. So this is a pleasure, and I look forward to our next one.
Thank you so much. Appreciate you. Well, have a good rest of your day. Thanks, Roger.
Thank you.
Bye. Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.